Let's continue going over how to prep for a doctor's appointment. How many of you have had a mental list of questions walking into the doctor's office, only to come out realizing that you didn't get to ask the majority of your questions? This is a problem for so many people. The best solution is to write your questions down before the visit and take the list with you. This is a cheat sheet for you if you get flustered in the appointment. Just the act of sitting down to write out questions gives you the opportunity to think about your health concerns more deeply. You may realize there are questions that you should ask that you didn't think about before. So generally, what kinds of questions do you think it's important to ask during a doctor's appointment? Do you have any examples from your own personal experience? Everyone is going to have different questions that are important for them to ask. At the core of it though, there are three main questions you should always prioritize. What is my main health problem? What do I need to do about it? And why is it important for me to do these things? Now is a good time to pause the video to reflect on questions that are important for you when you go to a doctor's appointment and strategies that you have to make sure you get to ask all of the questions that you need answers to. Next, we'll go over more ways to make the most of your doctor's appointments. Once you've prepared your questions at home, it's important to make sure you have a way to record the answers. It can be hard to remember everything your doctor tells you during your visit, but it's very important for your health that you follow your doctor's advice. To make sure you don't miss anything or forget what the doctor tells you, we recommend taking a notepad or a tape recorder with you to the visit. If you have a smartphone, many also have an audio recorder feature or an app that can come in handy. Even if you are able to remember the main points of what your doctor says, he or she may refer to terms that you aren't familiar with or want to look up later. It's so much easier to write these things down than to try to remember them later. If you want to use a tape recorder or a voice memos app on a phone, check with the doctor's office before the appointment to make sure it's okay, and ask the doctor before you turn it on. Also, make sure to practice taping before the visit and let us know if you want support. Make sure the batteries are working and that you know how to turn the tape recorder on, how to put it on pause, and how to turn it off. Make sure you're comfortable recording from your phone if you plan to use its recording feature. Another excellent way to make sure you get all the information you need is to ask someone to come along with you, a trusted companion. Asking someone to come with you to your visit can be a big help, especially if this person lives with you or helps with your health care. You could ask a spouse, a sibling, a child, or another close friend. Just make sure it's someone you're comfortable with discussing your physical health in front of. Having another person with you is good for several reasons. First, this person provides moral support. Secondly, if the person takes part in your health care, even if just to remind you to take your medication, it's important that they understand your doctor's instructions. Third, an extra set of ears is useful because the person can later help you remember what the doctor said. Fourth, if you need help reading and filling out forms, this person can help you with them. They may also have noticed things about your health or patterns in your behavior that you haven't noticed about yourself, and your doctor may find that insight helpful. Make sure you discuss with them what role you want them to play in the appointment in advance. Would it be most helpful to you for them to ask questions, or would you prefer that they just listen? Setting expectations around how they'll behave in the doctor's appointment can be important to how comfortable you'll feel. If someone comes with you, let the doctor know right away that you have someone in the waiting room who should hear everything the doctor says to you. And you can practice preparation. Let's take a moment to apply the skills you just learned for preparing questions. Take a few moments to jot down some questions that you think could be important to ask your doctor. Keep in mind the three major health priorities. What is my main health problem? What do I need to do about it? And why is it important for me to do these things? Often, it can be helpful to role play a situation so that we get practice seeing how we apply our skills in the moment. Let's take some time in our workshop to pretend one person is the patient and you're talking to your doctor. Remember to ask your doctor any specific questions about your symptoms, what your biggest health concern is, and what you can do about it. You can do a role play during this session, but you can also later do it at home with friends and family. Let's get started. Now that you're prepared and ready for your doctor's visit, your main priorities during the visit will be to communicate what's going on with you, ask questions when you need to, and write or record the doctor's answers and advice. To fully empower your doctor's visit, be sure to give complete information. Try to answer your doctor's questions as honestly and fully as possible. Can you think of a time that you didn't tell a doctor something about your health because you were embarrassed or uncomfortable? This is common. It's embarrassing sometimes to talk about our bodies or our behaviors, but this information is critical to helping your doctor understand your symptoms and make medical decisions. If you don't tell your doctor everything, they can't make the best recommendations for your care. Make a resolution to be honest, even if it's a little uncomfortable right now. Be honest about your physical activity, how much you smoke, if you smoke, how much alcohol you drink, if you drink, and what and how much you eat. You may want to ask your doctor a question that's a little embarrassing or uncomfortable. Remind yourself that the doctor has probably heard it before. Doctors are used to talking about personal problems with their patients. What you tell your doctor is private and is not shared with anyone else without your permission. Asking questions and being worried about your symptoms is not a sign of weakness. Being honest about what you are feeling doesn't mean that you are complaining. The doctor needs to know how you feel. Tell your doctor about aches and pains and other physical feelings you might have, like tiredness, dizziness, or nausea. Also tell your doctor about other types of feelings, such as feeling sad for a long time or feeling very anxious or stressed out. Say the things you think are most important first. Secondly, don't be afraid to ask questions. Don't be afraid to ask your doctor or your nurse what you want to know. Your doctor wants you to know all you can about your health problem or your chronic pain. He or she wants you to understand the steps you need to take to get better and stay healthy. Doctors know that it is important for you to take care of your health, and they want to help you through that process. It's okay to keep asking questions until you understand all of your doctor or nurse's answers and advice. Chronic pain is complicated, and getting to the root of your pain or your other health problem can take time, and that's okay. You can say, "Would you be okay explaining that to me one more time?" And finally, as we discussed, record answers or advice if you can, or bring a trusted family member. Many doctors will be willing to give you a printout or notes reflecting on your appointment. Feel free to ask for this information. Now you're ready to learn what to do after your doctor's visits in the next video.